So, as we all know, what previously known as tendinitis or tendinosis is now referred to as tendinopathy. Why? Because the tendinitis word itself is only about the inflammation, and it's not the only case when the tendon is injured. And it's more than the inflammation or a degenerative change that is going on to be able to describe it as a tendon injury, or hence why it's now termed as tendinopathy. That encompasses the disease process, the tendon issues, the change in the structure, the altered tolerance, and thereafter increase in pain. So in a way, tendinopathy is a misbalance in the rate of wear and repair. It's an ongoing process, as we all know. It's not an on and off condition. So, considering the population, basically anyone can get tendinopathy. So, be it a younger person or an older person, a very active person or a sedentary person, even if the person is lifting heavy, even if the person is going through repeated sets of overload, they are getting prone for tendon injuries. And with sedentary lifestyle, when a person is put on a sudden increase in activity, there are high chances and they are basically more vulnerable for getting tendinopathy due to the degenerative changes and the weaker deconditioned tendons. And when we see females, there are evidences that females with especially with menopause or obesity have high chances of getting tendinopathy. Why obese people? Because in them there is increase in tendon diameter, thereby there is stiffness, and then the load on the tendon is again varied. There's also metabolic conditions that influence healing. Basically, our diabetes, kidney issues. In fact, even people who smokes have tendency of going through a delayed healing. Risk factors seen are such as muscle conditioning, that is the muscle strength, and deconditioning or an unconditioning, such as person who has had a previous injury would have lesser strength, would be deconditioned or would be unconditioned for the load to be put on the tendon. Then the genetic factors, basically family history of a tendon injury also can show up on the person. Then there's aging, then there's rheumatoid conditions. But do we actually know that there is a difference between muscle and a tendon in terms of their properties and the healing processes that they go through? So muscles are elastic in nature, they're contractible, they're adaptable, they're flexible. In fact, their ability to work day in and day out is much more than a tendon. When considering tendon, they are meant to bear and maintain the load. They have less tolerance to stretch and the sharp forces, unlike a muscle. Then there comes the healing processes. Muscles has a very easy healing process, but the tendon has complex remodeling phase, hence why they have higher recurrence rates of injury. We can classify muscle injury into myofascial, muscular tendinous, and a tendinous injury. Alright, so myofascial injury, it takes about less than 3 weeks for healing. There is an inflammatory phase and a fibrosis phase. Considering the musculotendinous injury, there is inflammatory phase, there is satellite cell activation, there is a regeneration of myofiber phase. So all these takes about less than or equal to 8 weeks. Now coming to tendinous type of injuries, there is inflammatory phase, there is a collagen synthesis phase, wherein there is type 3 fiber formation. Then comes the remodeling phase, wherein these type 3 are turned into type 1 fibers. And then comes the maturation phase. Now this entire process of healing can take about 2 to 4 months. Remember when we said wear and repair, that tendinopathy is a misbalance in the rate of wear and repair. This basically means that when rest is not given properly to the tendon to repair, it will keep on forming the type 3 collagen, that too in a disorganized tissue matrix. And that will lead to vague fibrous scar formation, and thereby there will be increase in neovascularization, hence why there will be increase in pain signals. There is an interesting paper that says, is tendon pathology a continuum? It's by Koch et al. From 2009 paper. So this paper has put out a very simplified way of understanding the tendon pathology. So now to sum it up, We can say that if we put too much pressure or too much stress or load on our tendon, it will become reactive, hence by causing reactive tendinopathy, which is seen in the acute inflammatory stage. All right. Now, with continuously stressing it out without resting, it will be leading to tendon disrepair and thereby degenerative tendinopathy, wherein what is happening is type 3 collagen is being increased, and these type 3 collagen are not able to convert into type 1 collagen in the phase of remodeling, which is supposed to be done, hence by causing an immature collagen. Now, what we can do to get this back to normal tendon is we can manage, is we modifying the load put on the tendon. We can optimize by doing load management, one thing. And secondly is strengthening and thereby adaptation of the tendon to the load. In fact, we can educate the person that loading is good because it allows the collagen to lay down. But then repeated loading without resting is the worst thing. When there is repeated load, obviously there will be an overuse injury. Because this repeated loading without resting will be happening, there will be repeated inflammation, there will be that healing process that starts again and again and again from zero back again. Thereby there will be type 3 collagen that will be less adaptive, and there will be entire change in remodeling and maturation phase. And then this type 3 collagen will be less adaptive to cope with the load. Hence, it's very important to optimize the load, and the load management thing will play a major role in managing our tendinopathies. Secondly, we can do strengthening so that the tendon understands the adaptation of the load. So now when we look at the tendon healing cycle, it's very easy. It goes through inflammatory phase, the fibroblastic phase, and the remodeling phase. In the inflammatory phase, that takes about 3 to 5 days, there will be fibrin clot formation, right? Next for 1 to 6 weeks, there will be type 3 collagen production, that too in a disorganized matrix. That's when the remodeling phase kicks in, taking about 6 weeks to 9 months, wherein there will be reorganization of the type 3 collagen to type 1 collagen. That will be much stronger and in an organized matrix, and there will be cross-linked pattern. So here's an easy and understanding way of taking an assessment for all the tendons. Now the subjective assessment plays the major role in understanding about the tendinopathy much more better way in providing the correct load management for the patient. Firstly, you have to listen for the signs of overload. When that overload may have happened can be found out via our pain history. So basically ask the patient, when did their pain start? Was there anything other than usual that they were doing? Or has there been any change in their lifestyle, their activity, their work, their hobby, or their home? Or have they shifted cities, or they have traveled somewhere? Also, the past medical history. If the person has a history of trauma or injury or any autoimmune diseases such as rheumatoid arthritis or colitis or Crohn's disease, whatever it is, plays a major role in understanding about the tendinopathy. And we've also got to see their social history, how socializing they are. Coming to the treatment history, we have to ask them if they have seen any doctor, have they gotten relief, or have their symptoms again worsened from that. Then comes the pain location. Usually when we see tendinopathy, the pain will be usually localized or precisely area affected. Their 24-hour pattern is much more important again. The worsening thing at the night, even the aggravating and easing factors basically will give you what all is loading on. Now there's a warm-up phenomenon in tendinopathy, alright. Now patient says it's fine and that they feel okay at the time they're doing some particular activity. But later in the day, it starts to pain or something unusual is like felt. So this basically points out that there is a tendon related issue, because it is seen that tendon related issues warms up over time, unlike our muscle soreness. So taking the objective assessment, You can observe that tendon might be thicker. While palpating, you can see that there'll be tenderness and it'll provoke some soreness sort of. Seeing the range of motion is again very important. The active range, the passive range, the resistive range. Most important is these resistive ranges that stresses the tendon out. There's functional tasks are very again important because we have to check for the load capacity that the person can bear, and then this load capacity will guide us to making the rehab plan. So as I said, while managing the tendinopathy, patient education and awareness is very crucial because every tendon is different with person differences. There's no one training that is for all. So thereby it becomes very important for the subjective assessment to be top notch. So we have to see what all task is stressing out the tendon and how much the load or stress that they can take. Based on that, see, so for example, if the person is able to do 6 repetitions of heel raises, but then that causes pain to them, so we know that we have to give little lesser than 6 repetitions of heel raises for that patient. Now in the early phases we start with isometrics, but that too considering if the person's pain is increasing or is it relieving. And then we go on to eccentrics, then we go on to concentrics plus eccentrics, and then the later stages plyometrics. Now heavy slow resistance exercises are much more important. So the repetitive max progression is done week by week. Hence why they have to practice home exercise program, and they have to do it in an acceptable range of VAS scale. That is, consider the VAS scale shouldn't exceed 7. Explain to the patient that what is too much is too much. They don't have to go that much, and so be aware of it all. This is an overview of how you can manage a tendinopathy.